Hello, today is Monday, April 3rd, 2023. I am lying down on the floor in my room and it's almost 10 o'clock. So I'm going to read some interesting article that lately I was quite interested, 肝清气, because I think I have that symptom, but I'm not sure. This article is from Mayo Clinic, the famous #1 clinic in the world. And also, I would like to read this article to learn English by reading it loud. And I would appreciate any input from you guys, from the audience. So my purpose is dual. I would like to learn about encephalitis. The litis means inflammation. And also I would like to get educated on English. So here we go. Patient care and health information, diseases and conditions, encephalitis. Overview. Encephalitis is inflammation of the brain. There are several causes, including viral infection, autoimmune inflammation, bacterial infection, insect bites, and others. When inflammation is caused by an infection in the brain, it's known as infectious encephalitis. And when it's caused by your own immune system attacking the brain, it's known as autoimmune encephalitis. Sometimes there's no known cause. In some cases, encephalitis can be life-threatening. Prompt diagnosis and treatment are important because it's difficult to predict how encephalitis will affect each individual. Symptoms. Encephalitis may cause many different symptoms, including confusion, personality changes, seizures, or problems with movement. Encephalitis also may cause changes in sight or hearing. Most people with infectious encephalitis have flu-like symptoms such as headache, fever, aches in muscles or joints, fatigue, or weakness. Typically, these are followed by more severe symptoms over a period of hours to days, such as stiff neck, confusion, agitation, or hallucinations, seizures, loss of sensation, or being unable to move certain areas of the face or body, irregular movements, muscle weakness, problems with speech or hearing, loss of consciousness, including coma. In infants and young children, signs and symptoms also might include bulging in the soft spots of an infant's skull, known as fontanelles, nausea and vomiting, stiffness affecting the whole body, poor feeding or not waking for a feeding, irritability. In cases of autoimmune encephalitis, symptoms may develop more slowly over several weeks. Flu-like symptoms are less common, but can sometimes happen weeks before more severe symptoms start. Symptoms are different for everyone, but it's common for people to have a combination of symptoms including changes in personality, memory loss, problems understanding what is real and what is not, known as psychosis. Seeing or hearing things that aren't there. These are called hallucinations. Seizures, changes in vision, sleep problems, muscle weakness, loss of sensation, problems walking, abnormal movements, bladder and bowel problems, When to see a doctor? Get immediate care if you are experiencing any of the more severe symptoms associated with encephalitis. A severe headache, fever, and change in consciousness require urgent care. Infants and young children with signs or symptoms of encephalitis should receive urgent care. From Mayo Clinic to your inbox. Sign up for free and stay up to date on research advancements, health tips, and current health topics like COVID-19 plus expertise on managing health. Click here for an email preview. Causes. In approximately half of patients, the exact cause of encephalitis is not known. In those for whom a cause is identified, there are two main types of encephalitis: infectious encephalitis, autoimmune encephalitis. Infectious encephalitis. This condition occurs when a virus or other agent directly infects the brain. The infection may affect one area or be widespread. Viruses are the most common causes of infectious encephalitis, including some that can be passed by mosquitoes or ticks. Very rarely, encephalitis may be caused by bacteria, fungus, or parasites. Bacteria, fungus, or parasites. Bacteria, fungus, parasites. Autoimmune encephalitis. This condition occurs when your immune cells mistakenly attack the brain or make antibodies targeting proteins and receptors in the brain. Attack the brain or make antibodies targeting proteins and receptors in the brain. The exact reason why this happens is not completely understood. Sometimes the abnormal immune response can be triggered by benign or cancerous tumors known as paraneoplastic or autoimmune encephalitis. Other types of autoimmune encephalitis, such as acute disseminated encephalomyelitis, ADEM, can be triggered by infection in your body. This is known as post-infectious autoimmune encephalitis. In many instances, no definitive trigger for the abnormal immune response is identified. I don't like this idea. Let me read the reason one more time. This condition occurs when your body, your own immune cells mistakenly attack the brain or make antibodies targeting proteins and receptors in the brain. The exact reason why this happens is not completely understood. Sometimes the abnormal immune response can be triggered by benign or cancerous tumors known as paraneoplastic and autoimmune encephalitis. Other types of autoimmune encephalitis, such as acute disseminated encephalomyelitis, ADEM, can be triggered by infection in your body. This is known as post-infectious autoimmune encephalitis. In many instances, no definitive trigger for the abnormal immune response is identified. Benign or cancerous tumors. Interesting. Common viral causes. The viruses that can cause encephalitis include herpes simplex virus, HSV, other herpes viruses, enteroviruses, mosquito-borne viruses, tick-borne viruses, rabies virus, herpes simplex virus, HSV, Both HSV type 1 associated with cold sores and fever blisters around your mouth, and HSV type 2 associated with genital herpes can cause encephalitis. Encephalitis caused by HSV type 1 is rare, but can result in significant brain damage or death. Fever blisters. Other herpes viruses. These include the Epstein-Barr virus, which commonly causes infectious mononucleosis, and the varicella zoster virus, which commonly causes chickenpox and shingles. Enteroviruses. These viruses include the poliovirus and Coxsackie virus, which usually cause an illness with flu-like symptoms, eye inflammation, and abdominal pain. Mosquito-borne viruses. These viruses can cause infections such as West Nile, La Crosse, St. Louis, Western equine, and Eastern equine encephalitis. Symptoms of an infection might appear within a few days to a couple of weeks after exposure to a mosquito-borne virus. Tick-borne viruses. The Powassan virus is carried by ticks and causes encephalitis in the Midwestern United States. Symptoms usually appear after a week after a bite from an infected tick. Rabies virus. Infection with the rabies virus, which is usually transmitted by a bite from an infected animal, causes a rapid progression to encephalitis once symptoms begin. Rabies is a rare cause of encephalitis in the United States. Risk factors. Anyone can develop encephalitis. Factors that may increase the risk include age, weakened immune system, geographical regions, season of the year, autoimmune disease, and smoking. Age. Some types of encephalitis are more common or more severe in certain age groups. In general, young children and other adults are at greater risk of most types of viral encephalitis. Similarly, some forms of autoimmune encephalitis are more common in children and young adults, whereas others are more common in older adults. Weakened immune system. People who have HIV, AIDS, take immune suppressing medications or medicines, or have another condition causing a weakened immune system are at increased risk of encephalitis. Geographical regions. Mosquito or tick-borne viruses are common in particular geographical regions. Season of the year. Mosquito and tick-borne diseases tend to be more common in summer in many areas of the United States. Autoimmune disease. People who already have an autoimmune condition may be more prone to develop autoimmune encephalitis. Smoking. Smoking increases the chances of developing lung cancer, which in turn increases the risk of developing paraneoplastic autoimmune encephalitis. Complications. The complications of encephalitis vary depending on factors such as your age, the cause of your infection, the severity of your initial illness, the time from disease onset to treatment. People with relatively mild illness usually recover within a few weeks with no long-term complications. Complications of severe illness. Inflammation can injure the brain, possibly resulting in a coma or death. Other complications may last for months or be permanent. These complications can vary widely in severity and can include persistent fatigue, weakness, or lack of muscle coordination, personality changes, memory problems, hearing or vision defects, speech impairments. Prevention. Let me go over the symptoms one more time. Persistent fatigue, weakness or lack of muscle coordination, personality changes, memory problems, hearing or vision defects, speech impairments. Prevention. The best way to prevent viral encephalitis is to take precautions to avoid exposure to viruses that can cause the disease. Try to practice good hygiene. Don't share utensils. Teach your children good habits. Get vaccinations. Practice good hygiene. Wash your hands frequently and thoroughly with soap and water, particularly after using the toilet and before and after meals. Don't share utensils. Don't share tableware and beverages. Teach your children good habits. Make sure they practice good hygiene and avoid sharing utensils at home and school. Get vaccinations. Keep your own and your children's vaccinations current. Before traveling, talk to your healthcare provider about recommended vaccinations for different destinations. Protection against mosquitoes and ticks. To minimize your exposure to mosquitoes and ticks, dress to protect yourself. Wear long-sleeved shirts and long pants if you are outside between dusk and dawn when mosquitoes are most active. And when you are in a dusk in the nighttime, dawn in the morning, dusk and dawn when mosquitoes are most active, and when you are in a wooded area with tall grasses and shrubs, where ticks are more common, with tall grasses and shrubs, Yes, long-sleeved shirts, pants, between dusk and dawn. Apply mosquito repellent. Chemicals such as DEET can be applied to both the skin and clothes. To apply repellent to your face, spray it on your hands and then wipe it on your face. If you are using both sunscreen and a repellent, apply sunscreen first. Use insecticide. The Environmental Protection Agency, EPA, recommends the use of products containing permethrin, which repels and kills ticks and mosquitoes. These products can be sprayed on clothing, tents, and other outdoor gear. Permethrin shouldn't be applied to the skin. Avoid mosquitoes. Refrain from unnecessary activity in places where mosquitoes are most common. If possible, avoid being outdoors from dusk till dawn when mosquitoes are most active. Avoid being outdoors from dusk till dawn when mosquitoes are most active. Repair broken windows and screens. Get rid of water sources outside your home. Eliminate standing water in your yard where mosquitoes can lay their eggs. Common problems include flower pots or other gardening containers, flat roofs, old tires, and clogged gutters. Common problems include water pots, flower pots, other gardening containers, flat roofs, old tires, and clogged gutters, clogged gutters, clogged gutters, clogged gutters, clogged gutters, clogged gutters, old tires, flat roofs, uh, gardening containers, flower pots or other gardening containers, flat roofs, old tires, and clogged gutters. Look for outdoor signs of viral disease. If you notice sick or dying birds or animals, report your observations to your local health department. Protection for young children. Insect repellents aren't recommended for use on infants younger than 2 months of age. Instead, cover an infant carrier or stroller with mosquito netting. With mosquito netting. With mosquito netting. Cover an infant carrier or stroller with mosquito netting. For older infants and children, repellents with 10% to 30% DEET are considered safe. Products containing both DEET and sunscreen aren't recommended for children because reapplication, which might be necessary for the sunscreen component, will expose the child to much DEET. Tips for using mosquito repellent with children include always assist children with the use of mosquito repellent. Spray on clothing and exposed skin. Apply the repellent when outdoors to lessen the risk of inhaling the repellent. Spray repellent on your hands and then apply it to your child's face. Take care around the eyes and ears. Don't use repellent on the hands of young children who may put their hands in their mouths. Wash treated skin with soap and water when you come indoors. So we learned such expressions as clogged waters, clogged gutters, flower pots, or gardening containers. What else? Or old tires, flat roofs, encephalitis, infectious encephalitis, autoimmune encephalitis, diseases, virus, tick-borne, BORNE, tick-borne viruses, children, infant, with 2 months of age, skin, outdoors, indoors, when outdoors, spray, clog, what else? Dab, wash, indoors, thorough. What else? What else I learned? DEET. Look for indoor sign of viral disease. Get rid of what else? Share utensils. Practice good hygiene. Persistent fatigue. Your age. Infection. Autoimmune disease. Season of the year. Mosquitoes. Cover the infant carrier with mosquito netting. Avoid being outdoors between dusk and dawn when the mosquitoes are most active. When mosquitoes are still most active, avoid being outdoors from dusk and dawn, between dusk and dawn, when the mosquitoes are most active. Tick-borne viruses, enteroviruses, herpes, HSP, simplex. Causes. Went to see a doctor, change in vision, seizures, memory loss, change in problems walking, nausea, vomiting, muscle weakness, stiff neck. Symptoms. Well, that's it. Not much to learn from it because I already watched several YouTube videos on encephalitis, but I get more interested in autoimmune encephalitis because I don't think I got infected by viruses. But probably I have autoimmune problem because I have psoriasis or eczema. So that's the or dermatitis. So that's the problem. I think that's the problem with autoimmune disease. So probably that's the reason I suspect my headache, my brain fog comes from encephalitis, brain encephalitis, or brain inflammation. But so it has nothing to do with the virus, but more to do with autoimmune disease. Now, autoimmune disease maybe come from the weakness in my kidneys and pancreas. Okay, that's what Mr. Kim Byung-chul, my quack doctor from China, who is Korean Chinese, tells me always. He said my kidneys don't function properly, and it sends all the fever, heat, my body heat to the top, to the head, giving the headache and also increasing or reversing reversing my chi energy, my body energy, or increasing the body temperature. So that's the similar symptom of encephalitis, and that's why I was keen on reading this article. But before I go, let me see if I can pick up more frontalia, other words and expressions. I forgot. Infants, yeah, frontalia, the front skull, yeah, fontanelles, infant's skull, soft spots of infant's skull, known as fontanelles, okay? Memory loss, fontanelles. Let me go over and practice the exact pronunciation of fontanel. Fontanel.
Fontanelle.
Fontanelle.
Fontanelle. Fontanel. Fontanel.
Fontanel.
Fontanelle. Fontanelle.
Fontanelle. Fontanelle. Fontanelle. Fontanelle. Opening between the bones of infant's skull.
Fontanelle.
Fontanelle. Fontanelle. Fontanelle. Got it? Fontanelle. Fontanelle. Loss of sensation, muscle weakness, sleep problems, abnormal movements, bladder and bowel problems. When to see a doctor causes infectious encephalitis. Trigger. Okay, that's it. Thanks for listening. Take care. Have a good evening. Bye-bye. What the